Having a baby comes with an overwhelming sense of responsibility. As a new parent, your child is completely dependent on you to keep them safe. The most important safety device is always going to be your supervision, so always be on the lookout for new dangers. The World Health Organization recommends keeping your baby in your room with you, but in their own cot or Moses basket for the first 6 months of life. When choosing a cot, make sure it has no more than 2.5 inches between the slats or bars to prevent your baby's head getting trapped. The mattress should be clean and firm and tight-fitting, so the baby can't get trapped between it and the side of the cot. Sudden infant death, or SIDS, is the unexplained death of an otherwise healthy baby under 1 year of age. There's no way of knowing which babies might die of SIDS, but there are ways to reduce the risk. Always put your baby on their back to sleep, even for naps, with their feet at the foot of the cot to prevent them from slipping down beneath the covers. Have blankets coming up no further than their shoulders. Keep the cot empty from anything that could cause suffocation. No pillows, duvets or stuffed toys, and remove all plastic covering. Never place a cot beside a window or a radiator, as this can result in the baby overheating. 18 degrees Celsius is the ideal room temperature. Don't allow your baby to overheat. To see how warm your baby is, feel their tummy. Their tummy should feel warm, but not too hot. Don't allow anyone to smoke near your baby, and make sure anyone caring for your baby knows the correct sleeping position. A common cause of accidents for new babies is falling off changing units or other high places. To avoid this, choose a changing unit that's sturdy. Always keep one hand on the baby when changing, and keep everything you need within arm's reach, and never leave a baby alone on a changing table. When preparing your baby's bath, pour the cold water in first and then add hot water. Always check the water temperature before putting your baby in, have everything ready and close to hand before you begin, and never leave a baby unattended in water. Install smoke alarms throughout the house and check the batteries regularly. Eliminate fire hazards. Don't smoke, put out all candles, and cover fires with a fire guard. Check appliances for loose wires or frayed flexes. Never leave the room with a chip or a frying pan on. Keep fire extinguishers in the kitchen and anywhere there is an open fire, and close all doors at night.
What I'm going to run through today is the scenario that if you go to your baby's cot, you look at the baby, you think the baby's colour is not good, it's not the same colour it normally is, the baby's either pale, maybe grey, and what are you going to do if you think your baby's not breathing? First thing you're going to do is try and stimulate the baby a little bit and see, do you get any response from that? If not, you're going to look very closely to see, are they breathing or are they not? So have a look for about 10 seconds. If you feel they're not breathing, get the baby over on their side, clap on the back, looking at the baby all the time, seeing is the colour changing, is the baby moving, if there's anything visible in the nose or mouth, clear them away. At this stage, if there's no response, you need help on the way. Go to the phone, get professional help on the way, you need an ambulance on the way. So go back to your baby, lift your baby out of the cot and put them on a flat surface. Down on the floor on a blanket is probably the quickest, easiest way to do that. And put the baby in a neutral position, just flat with the head straight. Don't overextend the head or neck. And then the next thing you're going to do is you're going to give 5 rescue breaths. So you're going to put your mouth over the baby's nose and mouth and breathe into the baby 5 times. If the baby starts to respond at this stage and they're crying, coughing, spluttering, pick them up, comfort them. Still wait for your professional help, and the baby does need to be checked out in a hospital. If at this stage there's no response from your baby, you now need to think about giving some chest compressions. And you're going to give your chest compressions with 2 fingers on the baby's breastbone or sternum, and you find the end and 1 finger width above. With your 2 fingers, you're going to compress 15 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and 2 breaths. And continue with that 15, to 2 breaths until your help arrives or your baby improves. And pick the baby up, comfort them, and go to the hospital with your baby to have them checked out.